get tested for COVID-19. Testing can tell you if you have COVID-19, even if you don't have any symptoms. Then you can take steps to avoid spreading the virus to others. Here's what you need to know about COVID-19 testing. When do I need to get tested for COVID-19? If you have symptoms of COVID-19, get tested immediately. If you've spent time around someone who has COVID-19, but you don't have any symptoms, wait 5 days, then get tested. For example, let's say you have lunch with a friend on Sunday. On Monday, your friend texts you that he's just tested positive for COVID-19. You wait 4 more days and take a COVID-19 test on Friday. How can I get tested for COVID-19? There are 2 ways to get tested. You can take an at-home test. You can get at-home tests from your local pharmacy or buy them online. Many grocery stores have at-home tests too. After taking the test, you'll get your results in 15 to 30 minutes. Or you can choose to take a test with a healthcare provider. For example, you can go to your doctor's office, a pharmacy, or a health center. Healthcare providers have different types of COVID-19 tests. Tell your provider if you've tested positive for COVID-19 in the past 90 days, so they can decide which test is right for you. What can I do if I test positive for COVID-19? Stay at home for at least 5 days after your positive test, even if you don't have any symptoms. Tell people you had recent contact with that they may have been exposed to COVID-19. Wear a high-quality mask when you're around other people indoors, even at home, for 10 days after your positive test. Make sure the mask covers your nose and mouth. If possible, stay away from people who are at high risk for severe COVID-19 during this time. If you test positive and you're at high risk for severe COVID-19, you may be eligible to get treatment. Talk to your healthcare provider as soon as possible. If you don't have access to a healthcare provider, find a test-to-treat location in your community at covid.gov. Call 911 or go to the emergency room right away if you have trouble breathing, persistent pain or pressure in your chest, new confusion, trouble staying awake, or pale, gray, or blue-colored skin, lips, or nail beds. What if I test negative for COVID-19? Sometimes people get a negative COVID-19 test result even though they actually have COVID-19. If you get a negative result, consider getting tested for COVID-19 again. Wait 2 days, then take another COVID-19 test to make sure you don't have COVID-19. If you get another negative result, wait 2 more days and take another test, for a total of 3 negative tests. If you've spent time around someone who has COVID-19, even if your test is negative, it's still a good idea to take precautions for the next 10 days. Wear a mask when you're around other people indoors. If you can, stay away from people who are at high risk for severe COVID-19. For more information about COVID-19 tests, visit cdc.gov/coronavirus.